Hi, everyone. My name is Dr. Ksenia Gershberg, and I am founder of Empowered Mama Chiropractic. I'm super excited to have Dr. Elliot Berlin here with us today for Empowered Mama Summit. Dr. Elliot Berlin is an award-winning prenatal chiropractor, childbirth educator, labor doula, filmmaker, and podcaster. Together with his wife, perinatal psychologist Dr. ALyssa Berlin, he founded Berlin Wellness Group, a family wellness center in Los Angeles where he works primarily with pre- and postnatal clientele and during labor and delivery. You can find his weekly informative and entertaining podcast, The Informed Pregnancy Podcast, on any major podcast app. I'm super excited to have you, Dr. Berlin, and welcome to this podcast. And you have so much knowledge, and I'm excited to share that.
Thank you. Thank you so much for having me and for the incredible work that you're doing.
Thank you. So today we're going to be talking about my favorite topic, which is birth. Mm-hmm. And a lot of moms right now, we are living through the pandemic, and a lot of moms are switching from hospital births to home birth and birth center births. What advice do you have for them?
Yeah, I'm getting a lot of phone calls about that from people who are a little bit nervous right now and have babies at the hospital. It's interesting. We're kind of a home schooling family. We didn't homeschool for very long, just a couple at home, and there's a setting that's right for everybody. And I like homeschool and I like institutional school. There's benefits to both and there's downsides to both. It's just interesting because for the time that we were in the home birth circle and the time that we're in the homeschool circle, you saw such a big push against it from the mainstream. And now all of a sudden people are flocking to both. Like kids are stuck at home and parents are having to figure out how to educate them. And hospitals are a little different than they were for giving birth. There's a lot going on there, policy changes, and if somebody's sick, they're going to the hospital. So, if you're trying to avoid crowds in general, hospital is not necessarily the greatest option. So, on the one hand, I will say that the labor and delivery units, they have a tough job. They do have to keep their staff safe. They have to keep the other patients safe. And it's not easy. They have to make tough decisions. I wouldn't want to be in the shoes of the decision makers. But I was in the hospital with COVID, and everybody was extremely professional at the hospital. I was out there professional at what they were doing, and so I know that they're working really hard to keep everyone safe. And I still understand why people want to have babies not at the hospital right now, especially since part of what they're doing to keep people safe is limiting who can come in with you. Local hospitals here, I do a lot of birth work. Sometimes I'm not the doula. Sometimes I just come and do body work. And sometimes there's 4 or 5 people in the room besides the laboring person, that they brought with them, a partner, a doula, a parent, a sister, and me. So that doesn't happen anymore. Most of the hospitals around here either let one person. I heard for a little while they were letting no people, or if a partner comes, they have to leave right away after they have the baby. There's all sorts of different things going on. So it's really important to call the center where you're planning to have your baby and find out what their policies are. In terms of switching to home birth, home birth has its ups and downs too. Its pros and cons as well. And in my mind, it's important to give birth where you feel safe. A lot of people feel safe at home. It's their nest. They feel medically safe at a hospital giving birth because there's a safety blanket there. There's a medical safety tool to help you immediately. And sometimes people are on the fence. They're not sure if they want to give birth at home because they like that home environment and it is their own natural environment. It's like what other animals do. They go into a quiet area usually and where they feel safe and they relax. Their whole mind and body relaxes and opens up for the baby to come out. And sometimes when you get to the hospital, even though it has that medical safety blanket, you can almost hear the cervix slam shut as all of the clinical and sterile things that are in there. You know, that hospital gown does not make you feel safe and empowered, and the IV that they want to start right away doesn't necessarily make you feel safe and empowered. And just all the smells of the hospital and the bright lights of the hospital. So there's a pros and cons to both. I would say somebody who's terrified to give birth at home probably shouldn't. It's not a great environment to give birth if you don't feel safe. If you're on the fence, or if you're not sure, or if there's a little piece of you that thinks maybe I could do a home birth, then I think it's worth calling providers who do home births, midwives and some doctors that do home birth, and asking all the different questions so that you have more information. At the end of the day, I think information is power for most people, not everybody. Some people like to have less, data and have somebody else decide. But for most people, if you have the information, you can find out what benefits and risks there are to both settings and then make an informed choice.
Definitely. And I think that if you are having a home birth or a birth center, is there something specific that mom should be doing? I know that you have a specific unique technique that you use as a chiropractor. Do you suggest moms start prepping for labor?
Well, one of the things that happens at out of hospital birth is you don't get drugs for pain for the most part. Some of them have like nitrous oxide and other comfort measures that are non-pharmaceutical. But if you were planning to go to the hospital and get an epidural right away, not feel any of your birth, you sort of need to train your mind and body for a totally different experience. It could be an amazing experience that blows your mind and that you love, but it's also intense. I mean, I've never really seen, especially at first birth, not be intense. And intense is not necessarily bad. There are things that are intensely pleasurable, there are things that are intensely painful, and there's everything between. So I think it's really important to educate yourself on what happens at an out of hospital birth. Start to think about your comfort measures, start to get your mind and body ready for that type of physical and emotional marathon. Physically, the work that we do is mechanical. So the low back, hips, and pelvis are supposed to be very relaxed, very loose, very open. The baby's typically bigger than the pelvis, and the pelvis is designed to expand it around it and let the baby kind of drop and rotate through the pelvis without a lot of resistance. But sometimes the muscles are stiff and tight and restricted. Sometimes the joints of the pelvis where those bones come together don't move very well. And if we can release the soft tissue, which is usually body work, massage, and trigger point therapy, and we can get those joints moving better with chiropractic adjustments, then you go into birth with a more functional pelvis and hopefully less resistance for the baby to move down smoothly. On the mind part, there's childbirth education, there's yoga, there's sometimes even just getting a good amount of physical exercise can really have a positive impact on the mind. There's support. So since you're going to be at home, some people like a bigger team of people around, even if they're not right around you. I was at a birth recently where there must have been 7 or 8 of us. There was the partner, the mother, there was a second baby, so the older daughter was there. There was the midwife assistant, birth photographer, and me. I don't know how many people that is, but it's a lot. And it didn't, yeah, it didn't feel like too much. First of all, it's a large kind of environment that she has, but also everybody had their very specific role. Nobody ended up stepping on toes. And I think it turned out to be a fairly quick birth, but everybody kind of had their role, and I was a puzzle piece. I felt like a puzzle piece. And if you zone out and look at all the pieces, you see that each piece was necessary for the complete puzzle. Other people like a very quiet, small team, maybe just a midwife and an assistant and their partner, and even then cycling in so there's not so many people around them. You just have to kind of think, and also what kind of comfort measures will be helpful to you. For some people, it is massage and touch, and other people, it's certain types of sound or music or smells like essential oils. Some people want to give birth in water, which is not always an option at the hospital. Oftentimes it isn't, and could be an option at home. It's not always an option at home either, but it's important to kind of explore those things so that you can set up an environment. And you don't know. Sometimes you'll think you want something, and then by the time you get there, you want the total opposite. But to kind of set up some kind of intention on what would be a great birth environment and aim for that goal.
Definitely. I think having that birth team is so essential. And I think that's what did it for me as well. With my second, I had tons of people at my birth. And I think that birth team was so supportive, and I was able to have my ideal birth.
Oh, that's amazing.
What would you recommend to moms who are breech? I know you have an incredible movie called Heads Up. And what would you tell moms who are breech right now?
Well, in general, breech is a tough topic. The film is Heads Up, the Disappearing Art of Vaginal Breech Delivery, and there's a website for it, headsupfilm.com. And the idea of the movie is that I think a lot of, about 4% of people have breech at birth. But at 32 weeks, when we start looking, different providers start looking at different times, but around 32 weeks, 90% of people are head down and 10% are still not. And so a lot of people have to consider what to do if their baby doesn't settle into a head down position. And only about half of those actually have to deal with it, because about half of those will turn between 32 weeks and birth. Mostly in the United States, you are told that you have to have a scheduled cesarean at 39 weeks. So there's other options that sometimes people give. But up until 2001, it wasn't that uncommon to be able to find a provider who, if you met certain safety criteria, would attend a vaginal breech birth. You just go into labor and give birth like you would, but instead of the head coming out first, usually the butt comes out first, and the rest of the body follows. So that option has largely disappeared after. Over time, what happened is cesarean became a lot safer. Cesarean at first was very dangerous. A lot of people either died or had their uteruses removed. We did it as a last effort to save either the mother, the baby, or both. But over time, it's become very, very safe and predictable. And now that it's a lot safer and more predictable, so we want to know who would benefit from a cesarean birth versus a vaginal birth. And so there are definite groups of people. For example, if you have an active, STD, then it could be better to give birth by cesarean and prevent the baby from getting infected. And there are other things. There's placenta previa, where the cervix is covered by the placenta, and the baby would kind of have to smush through the placenta to come through, is kind of dangerous. So we have the option, thankfully, to do a cesarean birth instead. So that test was sort of put to breech babies. Are they better off being born vaginally or by cesarean, in a study that came out in 2001 called the Term Breech Trial. And the findings, the conclusion, were that babies have a small but statistically significant better outcome if they're born breech by cesarean than breech vaginally. And based on that, pretty much the United States and Canada shut down the option for vaginal breech delivery. It wasn't a law, but it was a strong recommendation. Subsequently, there's been more research on it, and not every case is the same. Sometimes you have a person who already gave birth twice to healthy vaginal babies, and now she has a breech, and she's in a lot different position than, let's say, somebody who's on their first baby. And also what type of breech. Some of these factors weren't taken into account in the study. And so, I don't think the option should have disappeared. The way I look at risk is you analyze risk and benefit. As a doctor, I think your doctor or medical provider should tell you, these are your options and these are the risks and benefits of both. And for some people, a risk may sound, let's say it's a 3% risk. Somebody may say that sounds very high, I don't want to take that risk. And somebody will say, no, that's a risk that I want to take. But I think it should be your choice. Every single day we make choices where we analyze risk and benefit. We get into a car and drive, which has a risk to it, a very significant real risk. But we don't hold the wheel thinking, what if I get T-boned by an 18-wheeler? We hold the wheel thinking, I need milk, I need eggs, I need flour, I need sugar. Obviously, I'm making pancakes. Anyway, it's true with all kinds of risks, and in healthcare especially, everything has risks and benefits. So the idea is, and there are still providers today who, if you meet certain safety criteria, they will attend your vaginal breech birth, and you always have the option to convert to a cesarean if you need to. So it's tough because I know in my area there's still a handful of providers who do it, but around the country there's a lot of places where nobody will do it. I have people sometimes fly in here 3 or 4 weeks before their babies do, or drive in here, just to be around providers who will do vaginal breech birth for them. So I think it's important. If you watch the movie just talks about how this kind of unfolded, and it's a starting point to have a conversation with your provider.
I think it's very hard to find providers I know that in my area, moms always struggle to find providers that will give that option. But it's nice to hear that in your area, there are more providers that do that.
Yeah, they're dwindling. They're dwindling. They're mostly older practitioners who did a lot of them when they were residents. I mean, that's the real big problem. I do see younger doctors with interest and intellectual curiosity, but the training's not there. And the training's not there because the volume is so low. In order to be able to attend a vaginal breech birth safely, you have to have experience doing them. And it's very hard to get the experience doing them.
And do you know why moms more opt out of even having that choice of, giving birth breech instead of C-section?
I think that for a lot of people, they don't know their personal risk, the risk factors, and they're just not given the option. For a lot of people, they think the risk may be a lot higher than it really is. And for a lot of people, no risk is worth it. And they only see the risk in the vaginal birth and not the risk in the cesarean birth. So I think that, first of all, many people are just not given the option. That's the number one reason. Number two, people are given the option or know that there's an option, oftentimes have an inflated sense of how much risk there is. And number three, even if the risk is small, some people would rather not take that risk. And I fully understand that and support whatever choice they make.
Do you see a lot of moms that are opting for VBACs after C-section?
I see a lot more moms going for vaginal birth after cesarean or trial of labor after cesarean than I used to. I think in 2010 there was a summit that explored intensely the risks and benefits of VBAC and accessibility to VBAC. And that the conclusion was that VBAC, in terms of a risk factor analysis, is in line with other obstetric risks that we take on a regular basis. The number one risk is that the scar in the uterus that was created with the first cesarean, maybe that scar tissue is weak and won't hold up to the intensity of labor when the uterus starts to contract and create all that pressure. Could that scar separate or pop open? And it's called uterine rupture, and it could be a serious complication. It's, in terms of risky or not risky, that's a decision only the person who has to do it can make. But we can give you the percentages of data, the latest data on how often it occurs, and if it occurs, what happens. Does that automatically mean disaster for the mother and or baby, or could we take action and everybody would be okay? And what are the percentages of how often this happens or how often that happens? And again, somebody will make a personal decision once they have the data. There's a lot more providers around the country now that offer VBAC for various reasons, but the number one reason is because they loosened the guidelines a little bit after that 2010 summit on VBAC. We also have a movie about VBAC. It's called Trial of Labor, which streams for free right now. If you go to trialoflabor.com, you can play it on Vimeo through the website. Again, this one is a little bit more, it's for women who previously had only cesarean birth and now they're pregnant again, and they are looking for a different experience. And so it's we took out all the talking heads. There are no experts there. There's no data and facts there. It's just the personal experience of the stories. And I see mostly a lot of success. I've seen a handful over my whole career of people who have had that uterine rupture. To my knowledge, they're all physically okay. Some are a little bit traumatized, like post-traumatic stress from it, but they're okay and their babies are okay as well.
And that's the most important. That's great to hear. and your movie is incredible. I'm glad that it's really nice that it's streaming for free right now. Moms can really
Thank you.
use it.
Yeah, since you have all that time to not go anywhere, why not watch birth films?
What would you tell moms right now that are pregnant and are about to give birth during this pandemic?
I think now there's a lot more focus on keeping calm and mental health than there has been before. And in some ways, I think that's actually a silver lining. There are a lot of silver linings here. Look, the pandemic's awful. It's causing a lot of disease, it's causing a lot of death, and it's causing a lot of financial ruin. But the people and all of those are devastating for individuals and families. Um, when we get through this on the other side, I think we will pick up the pieces, dust ourselves off. It's what we do, and rebuild, and maybe even rebuild in a stronger and better way. I know that for me, being kind of deathly ill in the ICU, and it's weird because it sort of reminds me of this JetBlue flight that I saw where the landing gear was malfunctioning and they were going to have to make this emergency landing. And JetBlue had just installed live satellite TV with cable news. So I could only imagine, as I was watching this drama unfold from the safety of my bed, what it must have felt like for people on the plane watching it unfold on cable news. And that's what it was like being in the hospital with COVID. You have it, and you open up your phone, and all the headlines are coming about how many cases there are, how many people in the ICU, how many deaths there are, and it's so kind of crazy, scary to watch it happen in real time. But what it did for me was really shift my focus and what's important in my life. I used to be a workaholic, and I was working too many hours for my own health and not really seeing my wife and kids as much as I need to. And now that we're home, it's kind of nice. So disaster aside, the silver lining is we're spending a lot of time together. We're getting more exercise, better meals. And I've refocused, although I'm going to slowly kind of ease back into work now. I know that I'm putting strict borders on my availability for work so that I can have better availability for family. In terms of birth, there was always this big focus on, I think what expectant parents focused on more than anything was the actual physicality of birth itself, how we're going to get this baby out of you. And in terms of post-birth, the focus was always on like gear, which stroller, which car seat, things like that. I think that now there's a lot more emphasis being put on the mental health area of it. I don't see the numbers from from hospitals where people are getting infected with COVID because they went to a hospital to give birth. I don't see significant numbers like that. It could change, obviously, but it seems like they're doing a really good job of protecting that. So physically, I don't think that there's a lot of extra risk, but again, risk is always something that an individual decides for themselves. But because of the intensity going on in the world right now, I think there's more effort being put on to, are you anxious? Are you depressed? Are you feeling stressed? And really getting into those feelings and talking about them, both for the individual who's pregnant and potentially their partner. And I think that's really good to focus on those things that have been under-focused on for a very long time. And even on the other side, kind of thinking about what will this be like, once this baby arrives and things change again in a very dramatic way. So I think there's some silver lining here. I think that, when a baby comes, there's a lot of pressure to get back to work right away, which is not the healthiest for the pregnant person and their partner. And now maybe couples will have an opportunity to bond a little bit, not have that external stress. Granted, there are other types of stress, but that like run away and not be a bonded unit stress. So hopefully we can focus on things like that and take advantage of that silver lining of this pandemic.
Definitely important. And I'm really glad that you're here with us and you fully recovered. And I definitely believe that parents really need that time together.
Yeah, me too. Thank you so much.
Thank you so much for being here with us today, and stay tuned for the next speaker for Empowered Mama Summit. Thank you, Dr. Berlin.
My pleasure.